I'm going to be meeting with the case manager and the two people from the program. Just, it's a meet and greet pretty much. They're going to come over, tell me about the program, what to expect, what's going to be going on. I mean, I would like if you guys would look at his medicines, and if you felt like you might want to try something else, whether it even be with the ADHD, because it's like, I for a long time, I guess I was hoping there'd be a medicine that would fix it. When people are like, oh, Abilify has this calming nature and da-da-da. When I don't see that, I'm like, how do I know if it's working? I don't know. Is he supposed to be breaking his doors and having these meltdowns? I don't know. Ethan has attention deficit disorder, hyperactive attention deficit disorder, ADHD, and oppositional defiance disorder, known as ODD, and with the underlying diagnosis of autism. So he's on the spectrum. He's high functioning, but just on the spectrum. It's almost like I kind of feel like at times I forced the other symptoms into play with the doctor, saying, look, he's obviously, there's something else going on. Like right now they say they won't diagnose him with bipolar, he's too young, but even if he's on meds that people with bipolar would take.
It's almost like a Ouija board experience, right? Where you take your child into the specialist, and it's like, woo, they interview him for a while, they give him a bunch of little tests, and then, I don't know, they're like, woo, oppositional defiant disorder. That's what it is today. You're like, okay, what do we do for that? Well, we're going to take this drug and this drug and this drug. And my child, I think he'd been on 12 or 13 different drugs, again, by the time he was 12 years old. A lot of these medications aren't tested in children. Many of them are off-label. Sometimes they're like for blood pressure or something. And that's a frightening experience for a parent.
At this point, a lot of the time, someone guesses at a diagnosis, medicates for it. Oh, the medication didn't work. Therefore, you probably don't have that syndrome. Let's try another one. And it feels like the child is a dartboard, and you're sort of thinking, we'll throw this, we'll throw that. Oh, look, that one seems to help. Okay, I guess he must have this. And the diagnosis is the result of a medication response rather than the basis for the assignment of a medication.